Welcome back to our case presentation series on some stuff that's not quite a typical chiropractic case, but we love working with the stuff here. The next couple of cases we have are about the shoulder itself. So this particular patient came in, they had some neck pain, I think it was midline neck, upper back stuff, and some left shoulder things going on. They were training for a big event. They had a big bet going with a friend about how much they could bench press. So we had to really make sure that they could get to feel better because, of course, they had to win the bet. So first couple visits, we assessed the neck, going back to some shoulder stuff. A lot of times we know from previous research, previous practice, and just stuff that's, we've been doing here for a long time. A lot of times what's going on at the shoulder isn't necessarily the shoulder's fault. The shoulder can hurt because there's actually something going on at the neck or in the upper back itself. So we make sure on the first visit when someone comes in with a shoulder complaint, we definitely assess how the neck and the upper back are doing. We do some test movements to see if that changes anything in the shoulder. And if it does, we kind of roll from there and we go until we're not getting any more progress, until we kind of stall out. And then from there, we assess and we keep on rolling. So this person definitely, they said, came with a stiff neck, came in with a stiff upper back, usually coming from some lower neck stiffness. So we started getting them moving on that. We assessed all the motions of the shoulder. We did our neck test movements, retested the motions of the shoulder. Shoulder started moving better, started feeling a little bit better. Great, we're going to roll with that for a few visits and see what happens. It's exactly what we did. So they went and worked out. They had less shoulder pain, but the pain was still there. Okay, great. Neck pain was also still there. So we spent a few weeks really hammering the neck and the upper back mobility stuff and working on those areas and getting those treated. Kind of meanwhile, kind of keeping the shoulder on the side just to see if that's because sometimes the shoulder takes a little bit to kind of change as the neck and the upper back stuff improve. But as we went, the shoulder stuff was not improving. So we went back and kind of reassessed the shoulder a little bit more directly while still treating the neck and upper back. And yeah, the neck will happen a lot of times when someone has shoulder pain for longer periods of time, is they just stop moving the shoulder. And even if the pain is coming from the neck itself, just that lack of use or the not using the shoulder will actually cause it to kind of tighten up and become its own separate problem over time. So that's when we know when we're not making any further gains or improvements in the shoulder that we need to address the shoulder a little bit more directly, and that's what we did. Because if you address a shoulder that's coming from the neck, you're just going to piss the shoulder off and keep it sore too soon into the treatment program, and we didn't really want to do that for this person either. So we went back and assessed the shoulder. We got a couple directional preference or different corrective exercises going for the shoulder itself. Worked out, felt a little bit better. Pain was still there. Great. Did some other treatment for it. Reassessed at the next visit, changed up the direction we were having to move and mobilize the shoulder, and it's been working really well. Got the bench press they were going for. They're very, very happy and proud of themselves, and we are very happy and proud for them. So that's been an interesting shoulder case where it's a neck issue, a shoulder issue, and it's kind of a combo of both issues. So the fun part on that one is to really kind of juggle and treat those individually. While not forgetting to actually, kind of treat them in combo at the same time, and try to keep all the parts, all the joints happy while keeping the patients engaged and really making sure that they're staying focused on the rehab program. So that was a fun case. If you have any issues about shoulder pain or anything neck pain related that can cause other things in the upper part of the body to hurt, feel free to drop them below. If you're in the area and dealing with some shoulder issues that you've been working on, been treating, things just aren't working right, also feel free to give us a shout. Look us up on our website, follow the link on Instagram or YouTube and see how we like to approach the treatments for this.